Welcome back. This is Baze Radio.co.ke. The call is Silver Kiddo. I'm joined live by Dr. Nyamute, all the way from Kisumu. Of course, the mind doctor, Dr. Nyamute. How are you?
I'm very fine, thank you.
You relaxed?
Yes.
A bit now?
Better.
All right. Tell me, man, for those that have tuned in, they want to know maybe who is Dr. Nyamute. Unajua hizi madaktari, kuna Dr. Kanyari, kuna Dr. sijui nani.
Yeah, so Dr. Nyamute, Linda is my other name. I'm a medical doctor. Studied in University of Nairobi. And for my undergraduate, then went back and specialized in psychiatry for my postgraduate. And yes, here we are.
How many years?
Undergraduate was 5 plus compulsory year of internship, so that's 6. And then you go back for your master's, which was 3 years. So,
where did you get all this time to study?
Where did you take your time?
I don't know.
I don't know. I think once you enter medical school, it's a good thing and a bad thing. You tend to shut off the world. When you're in medical school, you're in medical school. You know, and it's just...
You don't get distracted because I've seen friends dropping out, you know. I can't be in school for like 8-9 years.
Na nafaa kurudi shule, by the way.
Again?
I think we get addicted to reading and maybe stress. I don't know. Tunapenda tu kujipea shida. Sijui shida za kujitakia.
Of course, someone will ask me because I remember when I was surviving in Nairobi, I was given a role to play Pale Papashi Randula. You know, my role was like, kiddo, you come as a psychiatrist, you need to have a blazer, a tie. Najiuliza psychiatrist role yake ni gani? So someone of course will want to know, what does your job entail? What is your specification? Why a psychiatrist?
What does my job entail? So a psychiatrist is basically a medical doctor who deals with people who have issues to do with their mind. And the issues to do with the mind can stem from how we think, when we start having negative thoughts all the time, how we feel. You're feeling sad, you're feeling anxious, you're feeling, overwhelmed with life. To an extent, some people get suicidal, and we've seen a number of people, going the whole way of finishing their lives. To the way you behave, how you behave in the community. You're not able to go to work, you're not able to go to school, you're not able to, cater for your family or come through emotionally for your friends and things like that. So also how you behave. You want to keep alone, or you're drinking too much. So those are the kind of patients, or rather, the kind of work we do.
That's your work. Of course, you becoming a mind doctor, of course, there's a lot of things that maybe we don't know, Do you need to have your mind set in the right place? Like, of course, you're a human being, you have your own life. You get distracted. Maybe it might be umeshinda kwa traffic, pesa ijaingia, maybe mapenzi, someone is stressing you.
Yes, one, would I say, unique thing about psychiatry compared to other specialties is you can't fake. When you're not okay, it's be very difficult for you to give to other people. So your mind also has to be on track, because mtu anakuongelesha lazima uko hapo. You have to be present, otherwise ataongea kimaliza, you have nothing to say, you had nothing. Of course the patient will not be amused that nilienda kwa hiyo doki yako ananisikiza, hakuna kitu aliniambia, they not come back. So your mind also has to be on track.
I know for sure there are different types of mental disorders. You know very well. Kuna zile mental disorders ambao, of course, because mental health is an issue in the country right now. Because we're going to discuss about mental health. Of course, kuna watu ambao wanasema it's only for the grown-ups, it's only for the guys that are couples. Hata watoi, I believe they're going through something. But for that, we're going to discuss it in the next few, because I know very well you'll take us down on the mental disorders, effective prevention and treatment. Of course, kuna option za exit, unajua. Kila mtu hata kazini pia kuna stress, unajua watu wanapiga luku wao umeparara. But for now, I've got some music for you. Let's calm down kidogo with Vic West featuring the Exit band, Savara, Ben Soul and Joe Face, playing on Baze Radio, the CEO, the Sankoroko, of course, playing on Baze Radio, the CEO, the KE, the Habu featuring Okilamax. Maze, how are you? Of course, mtajua mjui niko na, Dr. Nyamute, the mind doctor, live on Baze Radio, the CEO, the KE. Guys, we know very well what is happening in the country. Of course, we started the year, I don't know kama ilienda sawa, because the things are not doing ni kama vitu haziada because the cost of living, stress ya maisha, economic hard times, frustrations. Kuna watu ambao walianza mwaka wakipoteza jobs, people are trying to survive, people are trying to adapt. About parents pia wanainua mkono, watu wanarudi ocha. A lot of things is happening because things are not going the right place. Of course the country haiko stable economically, shilingi inaanguka, dola imepanda. Just to ask you, because from the survey done by the Kenya National Commission of Human Rights estimates that 25% and 40% of outpatients and inpatients suffer from mental health condition. Now to ask you, what is the state of mental health in Kenya?
Just as is, it's growing by the day, especially considering the kind of, what I say, economical space that, you've mentioned. I don't know whether it's these problems were there. Now people are a bit more aware and they're willing to seek help, or they're actually growing. But it's a good thing. People are now much more aware. People are more open to come and say, si feel poor, compared to before. Whenever you are not feeling okay, people are like, away bana. Take this shot, you'll be okay. No one would be willing to listen to, hey, I'm having a problem. What do you mean you're having a problem? So we are having indeed people coming out to say I'm not feeling fine. And COVID, I think, was the opening space of mental health. I think people were bit now, people's eyes were opened, really. Okay, so if I feel anxious, that's a mental illness. Okay, that's mental health. Okay, if I feel depressed, that's mental health. Because before, people would think mental health ni tule mjamaa, utampata kwa streets anatembea, or in the market, preach from morning to evening, ametoa nguo, anakimbiza watoto akiokota nyasi, akiokota makaratasi, akikula nyasi. That is the idea we always had of mental illness. But then now people are becoming more and more aware. Ignorance is going down, that mental illness is not only about that. It's also from simple things about being unable to wake up and go to work. Today, tomorrow, 3 days down the line, you're having issues at work with your employer, you're having issues in your marriage, you're having issues with your family members. People are becoming more and more aware that mental illness is not only about that quote unquote madman. Yeah.
Of course we have different types of mental illness. I believe that nowadays ukiangalia kwanza Gen Z, economic vitu zimechange. Unajua watu wameadapt, vitu zimechange, watu wameshift attention. Kuna social media, unaamka asubuhi kidogo una feel like siko kwa mood. Hiyo ni cool thing, unasema uko kwa mood. It's not a cool thing. Might be a disorder. Of course kuna ile anxiety, either opportunity umeshindwa kulala usiku, kuna zile personal disorders, and then kuna zile eating disorder. But for that we're going to discuss about now the symptoms. You're going to take us through, because at times we don't know. You can see me happy on live on Baze Radio, like kumbe kido huko chini deep down, kumbe alifungiwa nyumba na asemi. Of course we are live with Dr. Nyamute, guys. If you have any burning question, please feel free to chat with me. You can send me a text on 0716-250-933. What do you really want to understand about mental health? Are you mentally okay? What is your mental state? Don't feel shy, Maze. I've got Dr. Nyamute. You don't need a consultation fee. Today it's live and free on Baze Radio, the CEO of the KE. Let You Die, Nikita Koring featuring Kemena, playing on Baze Radio, the CEO of the KE. Let You Down, Nikita Koring, of course, playing the Baze Radio, the CEO of the KE. Earlier on, if you tune in on Baze Radio, the CEO of the KE, welcome. This is Baze Radio. We've been discussing about the state of the mental health in the country. I've got Dr. Nyamute, of course, here to guide us, and then maybe kutueleza kweli tunakosea wapi, tunablanda wapi, because I might be a victim, I might be a patient. I don't know. Maybe you are. We don't know. Do you have any question, maybe a burning question you want to ask? Maybe uko na daktari hapa kidogo akwambia ukweli. Usilete lakini details, useme jina X. You can just send us a message, of course, on 0716-250-933. Of course, Nyamute, earlier on I've been asking my fans pale kwenye Baze Radio group fans about about why is it hard for Gen Z and the youth to open up about the mental health and issues facing them. Of course, there's fear of judgment, there's do they feel misunderstood, stigma and discrimination. Of course, you are in the right place to tell us about the symptoms about mental illness. How do you identify, like how do you tell, is there something like you can detect, like I'm not mentally okay?
Yes, I think just to put it simply, because sometimes when we speak medical terms we tend to lose people. Mtu anaongea kidogo ameshapotea.
Amepotea kweli.
Yes, so the first thing is, as you said, how you think. Your thoughts determine a lot. When you find yourself, you're constantly thinking about the same thing. It's over and over. It's today, it's tomorrow, it's the next day. And it's a thought that is giving you so much stress. It's a thought probably that you're not able to solve. It's a problem that is constantly in your mind that is now eventually making you feel sad. Kila siku unaamka like you're just sad. You don't want to leave, or you're not seeing the purpose or meaning of life. Unasikia tu, ay bana, why me, and a lot of people go through that space. And then now that results into a space where you don't want either to talk to your friends, ama unapata mwingine sasa alikuwa anakunywa 2 bottles of beer, sasa ameanza kukunywa 6, 7, namaliza boti mzima, or someone who was just okay ameanza suddenly kukua promiscuous, demi yote wenye anapata kusha maneno, so it's from simple things to when how you are on your baseline. Of course, kuna wale watu wanakuanga maybe introverts, they don't socialize so much, but how you are on your baseline. The minute you find yourself withdrawing from people or finding being around people exhausting, and these are people who are good, not bad company, that is. When you find yourself being around people is exhausting, being around your family is exhausting, going to work is exhausting, waking up in the morning kufungua TV curtains, my god, why? Ama unaingia kwa bed unatana unatos, it's 11, it's 12, it's 1 a.m, it's 2 a.m, bado hujapata usingizi. That is a problem. Unaenda, how people say after breakup unashindwa kukula, unashindwa kulala, those are mental issues. Now, there's a difference between having what we call psychological distress na mental illness. So psychological distress ni something is not okay, but haujafika, would I say, threshold ya kusema this is now mental illness. And the mental illness, there are different mental illnesses with different names, particular names. So saa zingine you're not okay, but you don't necessarily have depression. Just squeeze what kila mtu, mi niko na depressions, but what is depression really? Maybe you're just not okay, you don't have depression. So it's very important. When you're not okay, seek some help. You could be thinking you have depression and you're just having some psychological distress, which could be handled or sorted out early in time before ikue depression yenyewe.
Okay. Because pia Wakenya wanapenda ile jina Zakayo. I don't know, hiyo kutumia hiyo jina Zakayo inamaanisha pia you're not mentally okay. I don't know.
What does that mean? Maybe there's something I missed.
All right. Regarding now, if someone is opening up, is someone going through something, I don't know what is the right time for someone to see a doctor. Is there a stage? Is there like itabidi niende daktari? Because I know very well your job is very exciting, and then you have your own techniques to identify kuna zile skills mnakuwa nazo kusikiza mtu. But for that we're going to discuss in the next few. But for now, I've got some amazing song coming for you on Baze Radio to see the KE. Of course, Baze Radio, we've got an amazing playlist, amazing DJ. Yani tuna play top. Wasanii wanatoa mziki, wanatoa EP, wanatoa album live on Baze Radio, exclusive interview as well live on Baze Radio. I'm being joined by Dr. Nyamute. Yani mtu akikuona pale kwa street, jamani, vijana wa Nairobi akikuona tu kwa street hawezi hata hiyo jina ya doctor wanaweka kando, madam madam. Of course you're doing great. Of course your work is very entails a lot, because I know very well you've gone through a system whereby you are a professional now. Because we're going through a lot of things. Watu wanaweka status weirdly, tu mtu saa 6 ameweka status amesema peace is something great. Kuna mtu ameweka hapo meme. I don't know, Kenyans love for memes. I don't know, is a way of expressing, maybe releasing some stress, because I know for sure you are in the right place to tell me, kiddo, how do you tell, how do you see this guy is going through this? Are there procedures? Are there complementary therapies? Hizi story mtu anasema lifestyle, unajua usipopati pia inakupa stress. I don't need peer pressure. How is mental health treated?
Okay, so before we come to treatment, mental health, okay, let's call them mental illness, because everybody has mental health. Mental illness ndio si kila mtu ako nayo,
okay,
but everybody has mental health. So mental illnesses, by the time you come, we do an assessment that will involve a series of questions, which sometimes some questions may sound very weird, but tunaziuliza regardless. Then unlike a lot of other problems in the medical field, unlike a lot of other specialties in the medical field, hatuna test yenye you'll be like, nimekudunga test ya malaria ni positive ama negative, HIV unadungwa positive ama negative. There's no test particularly for mental illness where you can go, nimekudunga, oh, you have anxiety disorder, So it involves a series of tests, questions, which now eventually may or may not lead to a diagnosis. So depending on the diagnosis that you get, now that will determine what kind of management will come along. So sometimes we can give medication, sometimes we do therapy, sometimes we do both. And what will determine is how severe the condition is, how it's impacting your life on a day-to-day basis. If you see, sometimes kuna mtu anakata dawa anasema mimi sitaki dawa kabisa, but you're not able to sleep, you're not able to eat. I don't know how many therapy sessions, utaongea mpaka ufike hiyo point ya kulala, it will be a few weeks before the therapy starts working. So sometimes some people refuse medications not knowing that therapy, yes, works for the long term to keep you on that, but medications do help, especially in the short term, to help you with some symptoms in their sleep, appetite, mood. Mtu hawezi kuwa suicidal alafu mnasema, wacha tutaongea. It's been 6 weeks where you're waiting for things to change. So again, it depends on how severe it is. That will be assessed by your doctor, and then now we determine whether you go for therapy. Now, therapy can be alone, or in a group, or a couple, or a family. So again, hakuna ile unaweza sema this is the standard for every patient. Is treated differently based on their needs. Juu mtu akikuja pengine depression yake ni story na relationship, of course hiyo utaleta couple wake. Mwingine akikuja story yake ni which is very common. Hata ulete, until you solve that problem, it doesn't matter how many medications you give, it doesn't matter how much you talk to them, it doesn't matter. You have to come up with a solution that comes based, or rather tailored to their need. So yes.
Okay, just of course you mentioned about money and dough. Just to understand this, you're in the right place to tell me, who are the most patients you always see? Are they men? Are they women who mostly come for this mental illness treatment? And then what is the main difference between mental health and mental illness?
Okay, so the most patients, generally females have better health-seeking behavior than men overall. However, different disorders. So utapata when it comes to disorders such as schizophrenia, at least where I work, we see predominantly males for that. But then when it comes to disorders such as depression, they're predominantly female. Anxiety, predominantly female. But that is where I work. Different statistics will be different in different regions. Drug and substance abuse, alcoholism, addiction, predominantly male. So inalingana na hiyo siku wagonjwa wamekuja what disorders they are coming with. So again, it depends on the disorder. Some disorders are predominantly in male, some disorders are predominantly in female. Yes. Then you said difference between
mental health and mental illness. So
mental health, let's put it like this. It's like blood pressure. Okay? Let's use the analogy of blood pressure. Uko na blood pressure, si ndio? Whether it's high, whether it's low. But kila mtu ako na blood pressure. Okay? So now when you have low blood pressure, that's a problem. When you have high blood pressure, that's the problem. We normally know, mtu anasema mimi nakuanga na pressure, shida ya pressure. That is what they mean. So now with mental health, it's the same thing. Everybody has mental health. Whether your mental health is good, whether your mental health is bad, everybody has mental health. As long as you have a mind, you have mental health. As long as you have a brain, basically. you have mental health. Now, mental illness is now when your mental health is not okay. And that is what the symptoms we talked about based on your thinking, your behavior, and your feelings. That is now when we say you have a problem with your mental health. Now, is it a mental illness? Yes or no? Then, yeah.
All right, that's nice, Maze. Hey, you've tried to summarize for me to understand this, but of course, sherehe it's Yaba featuring Major. I don't know, kupiga sherehe mingi sana pia ni mental disorder, sijui, but Dr. Nyamu atatuambia because sherehe lazima ipigwe Nairobi every Friday. All right, now, of course, just to let you know that we've been discussing about the state of the mental health in the country, but for now, ni kama pale kwenye social media, we saw it, there's a video that was trending, you know, a young man who was left, there's a woman who gave birth after 4 days, akawacha infant, akawachia huyo boy, na akaenda for a rich man pale Kileleshwa. Of course, I'm trying to understand this because the man was crying. The man went viral for just calling Kenyans for help and coming out through, of course, about what happened. You are in the right place, doctor, to tell me what really triggered this man to come out and speak about this. What really happened? Was this something that they had already planned, discussed? Was it a way of maybe someone was not opening up, someone was not being honest? Because what happened was something weird and strange. Because how can you leave your own 4-year-old baby just to go to enjoy good times pale Kileleshwa because ni sherehe ameendea tu?
I think killer relationship like has its own dynamics, so it would be a bit difficult until you know what was, you know, that in problem, because everybody, he'll have his side of the story, she'll have her side of the story, and then there's the truth. So you wouldn't really tell particularly for that relationship. But overall, speaking as common problems that occur in relationships, you find sometimes venye tu mesema this sherehe unapata kidogo one night stand, boom, you know, and then ball kameingia, okay, wacha tukae pamoja, you know, and you decide, okay, let's try and figure this out. But as the time goes by, you end up finding, this person was not the person I thought they were, or we are not compatible as we thought we were. But I mean, there's a child, okay? And I think traditional relationships before, ulikuwa unapachika de mimba, wazazi wanawaita, huyo ndio atakuwa bibi yako na huyo ndio utakaa na yeye, you know. But the current generation right now, people are choosing, would I say to choose themselves? Then people are not staying in such spaces. So I wouldn't know what exactly triggered that lady, because for a lady, female instincts to live, I mean, just generally the animal kingdom, mothers don't leave their offsprings naturally. So, and especially that young. So I wouldn't tell what that was. Probably she has her own issues.
What really happening? What is going through this young man's mind right now? What should we do as Kenyans? Do we need to give him money? Do we need to book him for a therapy session? What is the right thing we should do for this man to recover all this?
I think probably needs a lot of social support, because I think naturally females are better off taking care of offsprings compared to males. So for him, especially, I'm assuming he's a first-time dad. So it's quite challenging, you know, what do you do with a child? You don't have breasts to breastfeed this human being. So what do you do with that? You don't have maternal instincts to take care of this child. So what exactly does he do? So he needs a lot of social support, especially, I don't know about his family and how the family is, but he does need a lot of social support. Financially, I don't know. I think the best way for this particular gentleman, you can only help people where they have a need. So rather than jumping in to help how you think is possible, simpler just to ask, how can we be of help? Na mtu atakwambia ndio hapa ndio nataka unisaidie. Because sometimes what we do is we want to help, you know, jump the gun and say, me, I'll come through like this. No, but that time, that person's problems are very, very different. What they really need probably could be very different. So it's always good to know, you know, how can I be of help to you? Niambia pana. I just want you to sit here with me. Help me take at least, chunga mtoto at least, like even for new moms, chunga mtoto at least for 6 hours at least, nilale, you know. So sometimes it's always good to just ask the person, how can I be of help to you? And then you come through on their point, you meet them at their place of need, rather than helping the way you think is possible.
Guys, it's high time now. We call our family. We check on we check up on our people that we love, our friends and family. Please, let's do that. Let's keep on checking on people. Send them texts. So to me, M-Pesa, but wapigia watumie message, because mental health is real, depression is real, suicide is real. Joined by, of course, Dr. Nyamute here to guide us, of course, on the mental illness, mental state, of course, the mental state in the country. For now, I've got some Checky, the MC GZ featuring Swigger on Baze Radio. Now, I check pale kwenye social media. Of course, you guys are asking so many questions. Of course, there's one of the question raised by Baze Radio listener. Just to understand this, because Kido, I would try help me. The question goes, Kido, I want you to help me because I know of someone, a friend, a very close friend of mine. Yuko kwa nyumba after alipoteza job. Of course, the wife is doing the rest of the things, but he finds it hard to open up, to speak, to let us know what is really, really happening. Because I know for sure people don't know where to start, don't know who to trust with the information, who to even call. Are there contacts? Are there procedures? Of course, kuna maybe first aid. I don't know.
So I think the first thing you can do as a family is just be supportive. Don't push someone to really open up to you if they can't open up to you. What you can do is, again, as we said, ask them, is there anything you can do to help you? And if you're seeing it's getting out of hand, they're not. Come through, like hawakwambi what is going on or anything. Na ukimuuliza, how can I help you? I mean, there's nothing you can do. Sometimes it's easier to just, seek a professional's advice and just, have them get seen and checked and helped on a professional way. So we do have call helplines, the most common being Red Cross, that is $11.99. It's free, you can call. There's also Befrienders, I think called Befrienders Kenya. They also have a free helpline whenever someone is, if you just need someone to talk to, probably either for yourself or for someone else. It's good to just have someone else come through, especially if you can't help them in a way and they need professional help. Because the worst thing you can do is sit with someone who's not okay and then, ajitie, inaitwa kujitia kitanzi. And then you say, oh my God, we should have done this. Why didn't we think about this earlier? We should have helped them at this point. Sometimes you don't want to expose their secrets, quote unquote, but then now you end up with the secret with someone who's 6 feet deep. Haitakuwa imekusaidia. So sometimes you have to break that trust, and especially if someone opens up to you if they're suicidal or something, sometimes it's okay to break the trust and say, you know what, nitakusaidia na nitakupeleka kwa professional. I don't care if you hate me, but you'll need this, because would you rather they love you and they're 6 feet deep? Area kuchukia but ako alive.
Yeah. Do you need to apologize for doing what is best for your mental health?
Definitely not.
So Arsenal fans don't need to apologize, yeah?
We would go fan wa Arsenal, go fan wa Gor Mahia. You do you, bana. You do you, whatever makes. Bora usumbui watu kwa space, like si kuzumbua ile ya kuheckle na nini, but like, as long as you're not causing significant chaos of something, you do you.
Okay.
Kila mtu na raha zake.
Of course, sometimes patients have the right to, disagree with their diagnosis. They have the right to refuse treatment. How do you manage to overcome this? Maybe try to come up with the best solution that they feel like, I'm involved in this treatment.
I think the first thing is to take them through the diagnosis that they have. Kwambie umekuja, you have symptom 1, 2, 3, 4, 5. As these symptoms are, they usually a diagnosis maybe of anxiety. So educating the patient, rather, unajua tumetoka zile enzi where I'm the doctor, mimi nakuandikia dawa uende umeze. I have to sit down and explain to you, this is what you're going through, this is the medication I'm giving you, and this is how the medication I'm giving you I'm expecting to help you in 1, 2, 3. These are the side effects that we'll expect to have. Ndio pia wewe you're on board, you don't feel like unapewa tu dawa for the sake of kupewa dawa. So the other thing, when a patient ako a bit reluctant, no, it's okay, I can refer you to another colleague, and it's your right to get a second opinion whenever you don't feel contented with one. Ni sawa, and seek a second opinion, and if that would help anything, why not? Because at the end of the day, see diagnosis yangu, like lazima nikuwekele kwa forehead. Okay. What we are interested in is that you get better.
What is that one interesting about your job?
The one interesting thing is I feel, you can't give what you don't have. So patient saa zingine acha nikuambie, saa zingine patient anakuja na kuongelelea juu ya heartbreak, alafu unasikia tu venye anaongea story ama juu ya relationship yake, alafu venye anaongelelea story, it is you, and you're just like oh my god, and then you have to sit there and advise them. Alafu kisha toka hapo you're like nimemshow, and then you have to reflect back because you're giving them advice of a similar situation you are in, and then you're like, can I really hear my voice back? Can I actually take in what I've said? Can I can I drink from the same cup that I'm serving? So it helps you also to work on yourself, become a better person, if I may say.
All right, thank you, Dr. Nyamute. Of course, so many people want to reach out to you on your socials. They want to know where you're located, your contacts,
Yeah, so where I'm located, Kisumu. Yes, Jaramogi Oginga Odinga Teaching and Referral Hospital, such a long name, but Kisumu. On socials, Dr. Nyamute on Instagram, Dr. Riel Nyamute on Facebook, Lynn Nyamute on TikTok, who else? YouTube, Mental Sphere. That was my predominant page where we talk about mental health issues. And yes, kuna platforms zingine. Yeah.
All right, thank you for coming through. Thank you for passing by. We're very grateful and honored to have you. You're such a vibe. You're such an amazing person. As well, guys, just to leave you with this quote, gratitude turns what we have into enough. Always start a day with the spirit of gratitude. Till next time, same place, same time. Kesho being a Friday. Tupatane mida saa 4 kwa block with Silver Kido to vibe, tuanze sherehe, because sherehe bila pressure ndo sherehe. Hakuna story ya kukanyagia sherehe. Till next time, shine. Amelina playing on Baze Radio.
This is Baze Radio.
We are 254 to the core.